Okay. Um, so thank you all for joining me today as we go over our new waiver service called the Wellness Education Benefit, or often referred to as the WEB. Let's go ahead and dive in. Our objectives today are to learn what the Wellness Education Benefit, or the WEB, is and why it was created, to understand the benefits of the WEB to members and the community, to learn about the enrollment process and the role case managers will have, and to review some talking points. So what is the WEB? The WEB is a monthly waiver service that will be mailed to CHCBS waiver members. Just a note, the WEB is only for CHCBS waiver members initially, but we'll be expanding to HCBS in 2025, but I'll say more about that a little later in the presentation. We utilize CHCBS member data to individualize educational materials containing simple and practical health and wellness practices. These educational materials will be arranged in groups of 3 articles to create the members' web, which will be mailed out to them. Articles will also be available in multiple languages, including English, Spanish, Vietnamese, Russian, Korean, Nepali, Arabic, and Braille. So our article standards, each article will follow these requirements. They will be brief at 175 to 350 words per article. They will be person first and use plain language, and they will be solution focused and action oriented. Each web will also include a QR code that can be scanned and provide the member with a digital version of their web. An article about how to use QR codes will be included within the first few months of receiving the web. And to show, just to give you a better idea of the general layout of the web, I have this high-tech piece of paper. I don't know if you can see this with my blurred screen. So the web's going to come as a bifold. Oh, is anybody having sound issues? I saw myself freeze a little bit.
I'm not on my end.
Okay. Okay, so it will come as a bifold. It'll be in an envelope, and the first external side will just have the address info in the little window. Members will pull it out, flip it. The other side will be a more generalized article, something like tips for better sleep, sun safety, ideas for having a balanced diet, things like that. Then the member will open up their bifold, and the internal articles will be more targeted. So there will be either 2 shorter articles or 1 full page article, but they'll be more targeted, like going into information about state benefits, how to quit smoking, if that's something the member's interested in, things like that. So does that make sense so far? Can you give me a thumbs up if it makes sense? I see a hand raised. Joyce, did you have a question? Oh, or was that an accident? Okay, well, there was an influx of thumbs. We'll go on to first article example. Members' first webs will contain this introductory article. After the initial couple webs, members will begin to receive webs that are more specific to their age, location, goals, etc. So this is just a hi, this is the web. These will be articles giving you information about these various things, like creativity and learning, school and work, gardening, cooking, health-related issues, anything like that and beyond. The second article example, articles are meant to be kept short so they won't overwhelm readers. And articles that hold a lot of information, like this one, other resources are included so members can do more research if they'd like to. Each article will also be paired with its own special photo. But for example, this article is about state plan and waiver services, so it provides a couple of links so members can look into it more, or suggest reaching out to their case manager if they have questions, things like that. And this third example, this example is mostly to show the formatting of the QR code, and you can see what our header is going to look like with the little mountains and the water. Like I mentioned, the QR code will appear in the interior of that bifold. When members use the QR code, it'll give them the opportunity to view their web digitally so they can zoom into text and use screen readers. All right, so I'm gonna pause for a second. Any questions right now? Comments, concerns? Really, I just needed a water break. Okay, so we'll go on to our next section. So member and community benefits. Monthly articles will allow for continuous conversations on specific health and wellness issues. The web will also help members maintain waiver eligibility by providing a monthly waiver service. The web will help improve members' health literacy and ability to navigate Medicaid resources by providing health information and resource contact information. And there are additional indirect benefits based on the types of articles members receive, like combating isolation and developing support networks. So some targeting factors such as age and member location will help determine what articles the member receives. Some examples are for younger children, how to make friends, and how to become more involved in school for teens. Individualized educational materials will assist with increasing health literacy, managing health-related issues, preventing hospitalizations, promoting community living, and achieving goals identified in person-centered service plans. Our data transfer process is secure and HIPAA compliant. We are working with a vendor named SmartSource, who has been working with other states like Washington on their own versions of the web for years. We provide SmartSource with data each month that they will use to identify which articles will be useful for each member. Once the targeted articles are identified, SmartSource destroys all of that data. The only record they will keep is a record of the articles members have already received. So they'll always get new information and won't get any repeat articles as time goes on. The web is a dynamic communication tool for members. We'll be able to create articles in real time to communicate department or state changes to keep members in the loop. And a good example of that, as I mentioned, the state of Washington has their own version of the web, and they were able to use that to communicate COVID updates in 2020 and beyond. So it can be really useful for any sort of current changes or updates. The web can reach those who may be socially isolated and help address other health equity gaps. It will lead to improved mailing address accuracy. And as mentioned, health education intended to promote health, lifestyle change, and community living among CHCBS members. Had another point, good break for questions if there are any. Again, feel free to type them in as they come up. Is this making sense so far? I'm assuming you're all nodding your heads. Okay, then we will continue. Oh, there is a question. If something comes back as undeliverable, will they then be terminated or contacted? So we'll get into this in just a little bit about return mail, but we do have a process where my team will be getting lists of members that the mail was returned. And we will outreach the case management agencies to then outreach and update the address. So we do have a process for that I'll go into in a little bit. Is this benefit for all HCBS members or just CHCBS? So initially, it will only be for CHCBS members. That's what's starting May 1st this year. So in just over a week. And then we'll expand to the rest of HCBS next year. And I'll show you a little timeline on that later as well. All right, thank you guys for your questions. We'll move along. So jumping into case management redesign, or CMRD. Why was the web created? So case management is currently offered as a service in the CHCBS waiver. Under CMRD, case management will become an administrative payment for all case management agencies to help achieve a goal of streamlining CMA functions. So as a result, case management as a service will be removed from the CHCBS waiver July 1st. That's still pending approval from CMS or Centers for Medicare and Medicaid, but still anticipated to happen July 1st. And the web will replace case management as a CHCBS waiver service. So to be clear, case management will still exist, is still important, members will still receive their case management. It just will no longer be considered a service under the CHCBS waiver. But the web is coming in as a new service under that waiver. And I see another question. Is the address pulled from the CCM or CBMS? We will be using the CCM, and I'll go over that process as well. Good questions. Okay, impact on CHCBS. CHCBS waiver members must receive at least one waiver service on a monthly basis to maintain waiver eligibility. So after case management is removed from the waiver on July 1st, only 2 waiver services will be available on the CHCBS waiver, and those are listed there. It's the IHSS health maintenance activities and now the web. If a member is not receiving HMA services and chooses to opt out of the web, they will lose eligibility for the CHCBS waiver. And some waiver members need waiver eligibility to access their state benefits. However, if a member is not receiving IHSS HMA services but chooses to utilize the web, they will maintain their waiver eligibility. So in May 2024, all current CHCBS members will be auto-enrolled to receive the web, and we've already started this process. Case managers will be expected to inform members of the benefit. That includes letting members know they can opt out of the web. However, members will lose waiver eligibility if they do not have another active waiver service in place. Case managers should ensure the preferred mailing address is correct in the Care and Case Management System, or CCM, at each member contact visit. Case managers should check to make sure that the web is on the member's PAR. And we'll go into more details about enrollment next, but I'm seeing a couple other questions. Give me just a second to see where we left off.
Hey, Rachel, this is Carly. I can answer some of those case management questions, but I was going to let you get through a couple more slides before we address those. I think some of them will be answered as you move through the slide deck.
Okay, so I'll continue on, and then if I don't address any of the questions, please let me know. Thank you, Carly.
Mm-hmm.
All right, so we'll go into enrollment, which I'm guessing there are some questions about, which makes sense. The web, like I said, will be available for enrollment in May 2024 for CHCBS members only. Members only receiving case management through CHCBS will need to be enrolled in the web between May 2024 and June 30th, 2024 to maintain waiver eligibility. So that way they'll have a service once the anticipated removal of case management from the CHCBS waiver happens July 1st. The initial group of CHCBS members will be auto-enrolled. Like I said, we're already in the process of that to receive the web starting May 1st. Then effective May 1st, 2024 and later, case managers will need to add the web service to the PAR. After the web is entered in Bridge on the PAR, it is then transmitted to the service plan in CCM. I'll show you what that looks like. This is an example of what the web will look like in the Bridge. Case managers will add the web service to the PAR as shown. And you can see here, you'll need to insert the effective and end date. Then select the wellness education benefit from the service dropdown. The service code is 98960, and the web service is spelled out, wellness education benefit. You'll need to enter the units, which will be 1 web per month for a total of 12 for the year. You'll also need to select at least 1 ADL or add a goal to the web PAR line prior to submission of the PAR. Once the web service has been added to the PAR, it will be transmitted to the service plan and CCM following the submission of said PAR. When adding the web service for a member, case managers need to confirm the member's preferred mailing address. It must be a current address or the member's at risk of not receiving their web, and confirm the member's preferred written language. And I'm going to repeat myself again. If a member chooses not to receive the web, please ensure they understand they must receive at least one service on a monthly basis to maintain their CHCBS waiver eligibility. So preferred address, it's wherever the member is going to receive their mail. So whether it's a home address, PO box, or wherever else, it's very important all this information is correct. Their full name, street address, city and state, zip code, and county. Streamline eligibility allows for an interface from CCM and CBMS through PeakPro transactions to communicate the preferred mailing address. So pictured here are the toggles in CCM that need to be switched on. So to yes, to the right, within the addresses section for the updated address to be transmitted. Please ensure the zip code is entered on the address, otherwise it may not transmit. When you update an address in CCM, it should be transmitting to the other systems. We just want to make sure we're being thorough with our information and these toggles to make sure it transmits as it's supposed to. So does that make sense? I saw a new question. What if what if parents are divorced and child resides at both addresses and both parents want to receive the web? So the child would be the member receiving the services, and it would just be the web would be going to them more specifically. So it would be more directed to the child. And also some articles will be directed to caretakers, but it's really going to be just one web per member. Another question, do we still add T1019 to the PAR? Oh, and jumped away from me. Okay, so Carly has a response here. I'll just read it out. Case management for CHCBS members will be provided by case management agencies as a targeted case management service from July 1st, 2024 forward. Although the billing manual is not yet updated to reflect CHCBS changes for policy and billing guidance, please reference the Persons with Intellectual and/or Developmental Disabilities waiver programs and targeted case management for home and community-based services waiver programs billing manual under the HCBS dropdown on the billing manuals page, and she's got a link inserted there. Now there was a question. Carly, do you know what the T1019 is?
Yeah, so hi everyone, this is Carly Altman. I work in the training and TA unit here at the department. Thanks for your case management questions. I know there's some additional slides here, but I think the overall questions about the PAR and do we add case management as a service questions is really what Rachel was just presenting on, in that case management as a service is getting taken out of the waiver as of July 1st. And this wellness education benefit is being added as of May 1st. They're not meant to, it's not that one replaces the other. But what is happening on July 1st, as some of you guys may have heard of, is that case management redesign will have gone through its final phase. July 1st is the beginning of having all of our agencies transitioned, which means that case management is now provided as an administrative service for all waivers. And so case management is going to be provided through the contracts for the case management agencies, rather than in the CHCBS waiver as a service line item on the PAR. So you will no longer be providing case management as a service from the PAR. It's going to be paid through the case management agency. What that means is some people on the CHCBS waiver, they only are receiving case management as a service. So when we remove that line item as a service, they will no longer have a service on their PAR on a monthly basis if case management is the only thing they're receiving, which is part of the reason why the wellness education benefit is getting rolled out to CHCBS members first, so that we can have a monthly service on their PAR and they can maintain their waiver eligibility. So as Rachel said, we're going to put the web onto the PAR for you for all the current members that are enrolled as of May 1st. And then after that, if you get new members that are going to enroll into CHCBS, you're going to need to add the wellness education benefit onto the PAR on your own, the same way you would add any other services like IHSS or case management. Starting July 1st, case management is not going to be a service anymore if it's approved by CMS. So that line item won't be able to be billed for anymore, and you won't be expected to be adding it to any, you won't be able to utilize it after that July 1st date. So the caveat is, like, and Rachel just said on the previous slide, it's still pending CMS approval. So you'll get communication where we give you the official communication that says, yep, this is approved by CMS moving forward. So for right now, keep doing what you're doing, but July 1st, that's when that case management's going to come off. And on May 1st, we're auto putting on the wellness education benefit. We're going to send out some written guidance to the participants of the web trainings that we've had so far that will lay all of this out. I've put some of it in the chat for you to read, but the question about the monthly case management as a service and the monitoring, so do we still have to contact them once a month? Well, July 1st, also with case management redesign, we'll be following the rules that have come out at 8.7 thousand. The monitoring requirements that are listed there are then going to be applicable to all of our waivers. So the current requirement in CHCBS, where it tells you have to do a monthly contact to review utilization or services, talking to the providers, interviews, etc., that will no longer be applicable to the waiver, and the other monitoring requirements will be. So that's why it's so important for the member to understand that if they don't enroll into the web, then they won't end up having that monthly service if all they're receiving is case management. They're getting IHSS, and that's happening on a regular basis. That is still going to count as their monthly service, so they won't be at risk for losing their waiver eligibility. So I hope that clears up some of the case management stuff. I do see one hand, Sharita, and then I'm going to pass it back to Rachel so she can finish up with the rest of the presentation.
I just had a quick question, and I'll go ahead and review all the information that you had sent over in the chat.
Sure.
On the ICFA website.
Yeah.
I've never had this before where a CHCBS only had case management as a service. I've always had it combined with IHSS, but in the event that someone is just doing the case management, how does that work with providers, with the PAR? I mean, exactly. I mean, we can tell the providers exactly what you just said, how that's changing on July 1st, all that good stuff. But how, I guess, do you still have to go through a provider for web, or is it just like, you know what I mean? Like they don't need to go through a provider. Like we don't need to do a PAR, right? Or do we?
Well, if they're only receiving case management, they're gonna have to get a service on their PAR. So the wellness education benefit is kind of the service that they should enroll into, right? Because the only other option for them would be IHSS.
Right.
But if they don't want IHSS or don't need IHSS, then they need to get the wellness education benefit so that they can have a monthly service on a PAR. And then
that
PAR,
would be
the wellness education benefit is done through a provider. So that's the provider.
Would that be us? Or
well, you guys are the case management agency, so you're providing case management on an ongoing basis, but it's just not listed on the PAR anymore. And that's lining up with the rest of our waivers, right? We don't put case management on the par for any of our other waivers. It's actually paid through the contract that the case management agency has with the department. And that's what's happening on July 1st is we're moving towards that model for this waiver.
Okay,
So
makes
case
sense.
management agencies are still going to be paid for the case management you guys are doing. It's just not going to be put onto a par.
Okay, that makes sense. I just want to make sure I have it in my brain.
Yeah,
Thank you,
it's
Carly.
a little tricky because it's sort of happening on the back end of billing and how do we pay for case management? And we want CHCBS to line up with the rest of our waivers that we offer across the state because we have 9 other waivers besides CHCBS. And this is the only one where we're offering case management as a service. So we're going to line that up with the rest of our waivers and have the payment structure be the same. But members still receive case management. That was a really important factor that Rachel said at the beginning, right? We're not taking away case management from these families. It's just going to be paid for in a different capacity, and you'll be following some different structure of rules for monitoring these cases.
Okay, thank you.
Thank you, Carly. And I do see one other hand. M. Silva. You're on mute in case you're trying to talk.
Oh, I'm sorry. I didn't realize I had my hand up. Let me lower my hand. Sorry.
Oh, okay, no problem.
Sorry.
Okay, and thank you, Carly, for going over that. She's much more well-versed in a lot of these matters, so we appreciate her.
Thanks,
And-
Rachel. I'll let you jump back over to the presentation, and if there's other case management questions that come up, we'll circle back to those when you're done.
Perfect. And we're gonna talk about preferred addresses just a little bit more. So like I said, having all the correct information is gonna be vital for members receiving their web. So please ensure the following items are completed, otherwise it may not transmit as it's supposed to. Ensure you have the zip code and the address. The member must have a 100.2 assessment in completed status in CCM. And the member must have a program card associated with that 100.2 assessment in any status other than closed. All right, so those are important to make sure these addresses get updated appropriately. And now I mentioned before with return mail, so this will be our process for it. So HCPF, myself, and my team will receive lists of return mail throughout the month. We will then notify case management agencies as those lists come in. So we'll provide lists of which members need their addresses updated. The case management agencies will then conduct member outreach for updated addresses. The CMAs will then update the member's preferred mailing address in CCM, and the member will then be sent next month's web. So once those addresses are updated, we'll be able to capture those updates when we pull our data next for the next mailing of the web. So if the member has a couple returned webs, it won't be a huge deal. It just means we need to get those addresses updated. We won't immediately snatch away the web if they have a couple. We're going to make efforts to make sure all that information is updated and they can continue receiving their web. I did see, I think, something in the chat. So just to clarify, effective 7/1, we will bill for TCM the same way we are for the rest of HCBS waivers. Yes, that is a good clarification. Yes. All right. There will be 2 monthly mailings of the web to ensure new members receive their first web within 30 days. So case managers are expected to update members' preferred mailing address in the CCM by the first Tuesday of each month for that first mailing, then by the third Tuesday for the second mailing. Each member will still only receive 1 web. That second mailing is just to capture members who were added, say, in the middle of the month. So if a member is added the 10th of the month, they're missing that first mailing and will be captured in the second mailing as long as their address is updated. Does that make sense? I do see another question in the chat. Will notification come through a list on the shared HCPF CMA SharePoint site or in some other method? So we are looking at using the SharePoint site, getting the details on how that's going to work, but it sounds like that would be the most ideal method. Otherwise, there will also be email communication. We may utilize both. But yeah, the SharePoint site is going to be a really good tool for us to communicate that, yes. Okay. So another question, is it only new members that will receive 2 mailings? So no, every single member, no matter when they're added, will only receive 1 web mailing per month. So that second mailing is only meant to capture those brand new members. So the ones that were added. So say in May, for example, we're auto enrolling everyone. Our data pull and everything will start beginning of the month. So any members that are then added, say May 10th, 11th, 12th, they missed that first mailing. So they'll be captured on that second mailing. And then moving forward, will be captured in the initial mailing. Does that make more sense? And it's just to ensure they're still getting a service monthly. We want to make sure we get it to them within, a month's time. Yeah, of course. Okay, we'll talk about everyone's various roles. So for the member, they'll need to indicate to their case manager that they want the web, ensure that their preferred address is current, identify any accommodations they may need, identify their preferred written language, report issues to their case manager, and respond to an automated survey. The automated survey is not a requirement, it just will be offered. So we want to encourage member participation. HCPF will be responsible for the data reports to inform article selection, contract management, quality assurance, production of articles, and to inform CMAs of return mail. The case managers, expectations to explain the benefit to members, to enroll members after May 1st, confirm the auto enrollment, and then any updates to enrollment as time goes on, and then to update those preferred mailing addresses. Our provider, who I mentioned is SmartSource, is responsible for our service delivery, graphic design, article translation, system operations, production reports, quality assurance reports, and annual member surveys. So the annual member survey will just be an automated phone call. Again, we'd love to encourage member participation. We want to know if there are any issues, if they love the web, hate it, any changes. But again, not a requirement. And then I did see another question. Are we able to see what they are receiving? So like getting a copy of the web.
Yes.
Yeah, so there will be a type of method for that. So as HCPF is monitoring this project, we'll be receiving a couple physical copies, and we're discussing being able to share those. So each member will have a different variation of articles, and getting copies of all of those would end up being quite a lot. So, but we can talk about ways of like posting examples of what members could be receiving that month.
Are these web articles that they're receiving monthly on their personal preferences, or is it just a general newsletter being sent to all families? Or is it something like they can filter and say, hey, this month I'm interested in food or housing? Or is it person-centered, or is it just kind of general?
It's person-centered, but it's not going to necessarily be the member selecting what information they want. It will be information that we pull based on, like we mentioned, location. So if a member lives in an area that's prone to wildfires, we'll have specific information about air quality safety and fire safety, things like that. Based on their age, if say the child's 5 and under, we'll have more caretaker directed articles, ways for caretakers to take care of themselves, different resources, things like that. So we will pull information about the members to help target what articles they receive, but it won't be necessarily like a checkbox, what information, are you looking to receive? But that's what we're hoping with those automated calls. Members can let us know if the information they're receiving is beneficial to them. Is it specific to them? Is that something we need to work on? Things like that. Okay, and so I jumped to this page, the web talking points. Information may be a bit repetitive, but this would be a good slide to take a quick photo of for when you may need to explain the web to members, or just to remind yourself how the web is useful. It will provide educational materials regarding health and wellness. It will provide state resource information such as food, housing, state contacts, etc. It acts as an ongoing monthly service, which helps maintain waiver eligibility. And again, explain to the members they have the option to opt out. Just make sure they understand the implications of that they'll need another monthly service to maintain their eligibility. And the member could be at risk of losing their waiver services if they do not have another service in place at least every month. So give you a second to take a picture of that. I think there was another question in the chat. How do case managers confirm auto enrollment? So you should be able to see it listed as a service. They're still being added currently, but by May 1st, it will be listed in there as a line item service. Awesome. Okay. All right. We have reached our conclusion. So I'll show you our timeline. In March 2024, the Web Code of Regulation became effective. Now, May 1st, 2024, so very soon, the web will be live and accessible to CHCBS members only. July 1st, 2024, still pending CMS approval, case management benefit will be removed from the CHCBS waiver. January 2025, the Web Code of Regulation will be updated to include all HCBS waivers. And then in winter or spring of 2025, we will create some new case manager trainings, very similar to this, to discuss that expansion into all HCBS waivers and what that will look like. It should look pretty similar, but we'll have those new trainings for you. And then in April 2025, the web benefit will be active for all HCBS waivers. Final review and key takeaways. This is another good slide to take a photo of, just as reminders to yourself. This is a lot of information. The web is a monthly mailed service that provides educational materials to members. Web utilization allows members to maintain waiver eligibility. The web will begin for CHCBS members in May 2024, and then will expand to all HCBS waivers in April 2025. All current CHCBS members will be auto-enrolled for May 2024. All CHCBS members added after May 1st, 2024 will need to have the web added by their case manager. And then there will be new trainings offered around winter or spring 2025 to address the process for adding those HCBS waiver members. All right, and I want to open it up one last time for questions, but I'm going to land on this page. So this first link up top is the web website. It's just kind of a general explanation of what the web is for your reference, or if you want to provide it to members, they can refer to it as well. The next link is where you can find this training. You can find like the PowerPoint and everything to do with this training, another recording of it, and all of that. And then any questions you think of later, or if you have any feedback or comments, you can email us at HCPF_web, WEB @state.co.us. All right, do we have any other questions? I love that comment, Shreya. We're hoping so.
Hi, Rachel. This is Amy from Rocky Mountain Human Services. I was just
Hi.
wondering, hi, can you back up like 2 slides? The first one that you said to take note of?
Yeah, give me just a
Maybe it's-
second. This one or the one after?
Yes. Nope, that one is perfect. I just want to take a quick, thank you so much.
Yeah, of course. And everyone, if you think you don't want a photo of this, maybe just take it just in case. All right, that's the end of the presentation. If you don't have any questions or want to stick around for discussion or anything, feel free to hop off. Thank you for joining. Yeah, we're excited to get the web rolling. Okay, I do see one roll in. Will there be job aids available to new staff? So the website linked, so I'll jump back to that page. I think we had time for photos. So this page, so where that this training is going to be posted, we're also going to include like a frequently asked question page as well as kind of a step-by-step guide. So those things will be posted, and I'll make sure to send out with the case management newsletter updates of when those are posted and where to find them. And
And
specifically,
Jen, this is Carly. You can still use the job aid that is available for the care and case management system on addresses, updating addresses. That job aid will still be applicable for you in this case.
Perfect. Yeah, just wanted to see if there was one that was coming specifically for this or not. But that we
There's
can
gonna
call
be
out that
some
that job
additional-
aid is.
Yeah, there's gonna
Okay.
be some additional resources like Rachel said, but then we'll end up linking, I think, to that the CCM job aid as well. So
Great.
all the same info there for address purposes.
Cool. Thanks, Carly. Thanks,
Mhm.
Rachel.
yeah, of course.
Oh, do you want me to, I can take this one too, Rachel. The benefit of the CHCBS waiver, if the family does not use the IHSS. So Judy, right now, there are families who don't have IHSS and are only utilizing case management, but while they are then able to enroll into the CHCBS waiver, what that does is allow them, as with every other waiver, for a member to access all the other state plan benefits that Medicaid provides. So a family might only be receiving case management through the waiver, but they might also be accessing some specialty services through regular state plan Medicaid. Because they have the waiver, they're then able to access that state plan benefit. They might have specialty prescriptions that they're accessing, other type of medical care that's not covered in our waivers, that if they weren't enrolled into the waiver, they wouldn't maybe qualify for regular Medicaid. And so they wouldn't have access to those services on the state plan benefit. And I don't know the percentage off the top of my head, but there's a fair number of folks that are enrolled in the CHCBS waiver across the state that don't utilize IHSS.
Thank you, Carly. And good questions. Okay. And like I said, I'll hang around in case anyone thinks of anything else, but thank you all again.